So now we're starting again, and we're having a topic that I think is really, really interesting. How do you know people's condition over time? How do you see the needs after transplantation if you don't have something to follow up with? I think that's a crucial question within all areas. In Sweden, we do have quality registries. We can follow up from a patient is coming in to hospital, and there is a registry for emergency medicine, or for diabetes, or for almost every condition or diagnosis. We have something to fill in and to follow up with. And in this area, where people have really been through a life-changing surgery and a life-changing, event, really, how do you follow up this for a longer time? I think when we talk about health data, we heard earlier about the European Health Database, that we really need to see also the needs for transplanted patients to have the same opportunities as there are in other areas. And I don't see that today. Maybe I'm myself had a heart transplant 16 years ago, and I've been involved also in politics. I'm a former policymaker. I think I have a clue, at least, what is happening in this area. And therefore, I'm so happy that ESOT is taking this seriously. And I would like to present David May, who is the CEO of ESOT, to present what's going on from your side and what you are trying to achieve in this area. Please.
Thank you, Pernilla. Good morning, everyone. First, I wish to extend, on behalf of ESOT, our congratulations to Pernilla and her colleagues for the second edition of the FOKUS Forum, and we're very delighted to be here and support it. It's an important meeting. As Pernilla just mentioned, the aim of my talk today is to give you an overview of the ESOT registries. The first part of the presentation, sorry. The slides are not showing. Okay. All right. The first part of the presentation is essentially about the background of the ESOT registries, and the second half of this presentation is a most up-to-date state-of-the-art of where we are with this massive project. I actually took the liberty to add "and beyond" to my talk, because as we dive into the heart of this pan-European registry initiative, I want to begin to acknowledge the diverse and complex environment in which ESOT operates. So Europe, as we know it, it's comprised of a tapestry of nations and territories. And however, within the Council of Europe, we have a network of 46 member states, each with its unique cultural heritage and healthcare systems. And moreover, within these states, 27 of them are members of the European Union, adding another layer of complexity in our cooperative efforts. And when we talk about healthcare systems, we must also acknowledge the vast array of approaches and practices across all these countries. So now, why did we, on behalf of ESOT, added the word "and beyond" to the title? It's because ESOT's reach and extends, they go beyond the border of the boundaries of Europe. And in fact, in our constitution, we are looking at the Council of Europe, and this expansion demonstrates our commitment to the collaboration, knowledge sharing, in improving transplantation outcomes, not just within Europe, but also with our global partners. We launched the registries in 2021. We embarked on the establishment of a comprehensive platform to meet the need of our stakeholders. Some of these have been addressed by previous speakers and also in the introduction of Benila. But this initiative essentially leverages from the rich experience from our liver sections, ELITA, which is renowned for its effective coordination of the European Liver Transplant Registry, the ELTR, since its inception in 1985. The platform is designed with modularity and scalability, with the guiding principle to facilitate capacity to accommodate and manage data that are pertinent to diverse organ transplantation procedures. And in essence, it's conceived as a unified and integrated repository, and it's intended to expedite the contribution of the data and the spread of best practices among European national and local authorities, and beyond. As you can see on the slide here, our primary aim can be distilled into several distinct objectives. But overall, we want to understand the consequences associated with organ donation and transplantation outcomes, both for living donors and recipients. And this pursuit is indispensable in our overarching mission to optimize transplant procedures, elevate the standards of patient care, and also address health inequalities in our field. We have a number of challenges in the development of this endeavor. I'm not going to go through them. I'm going to go through the most important ones. One of the challenge is developing, of course, and maintaining a platform demands a substantial financial commitment. And the design and upkeep of the platform that can seamlessly accommodate data on various organ transplantation necessitate adequate financial resources. And of course, the challenge is not about the initial investment, but it's also ensuring the financial sustainability of the initiative and also ensuring that the long-term mission remains. At the heart of the challenge that we're currently also facing is the complexity of the coordinating efforts. We have many stakeholders involved. The ESOT Pan-European Registries involves many actors, as you can see on this slide, including organ procurement agencies, hospital, governmental authorities, and transplantation centers, and of course, the integration of patient-reported outcomes. PROMS data are an incredible and valuable resource for patient-reported insights, and it requires also a specific action to ensure its effective incorporation into the registries. We obviously also need to address the long-term objectives because it requires a strategic action. So we advocate for sustained frameworks and support as the long-term sustainability of these registries. And for instance, when we talk about easier framework, just to give you an example of one of them is the regulation framework. And here I'm specifically referring to the GDPR. We have seen during the COVID pandemic that when the rules were lifted to share data, it was possible to have, quick access to data, and we could give a quick response to the pandemic. And this support is vital to continue the data collection, the analysis, and the platform enhancement to ensure that the registries are useful over time. So for us, maintaining a strong stakeholder engagement is absolutely crucial, and it's part of our long-term strategy. And I would say also that within this endeavor, one of the cornerstones of the registries is also supporting evidence-based healthcare policies, because we want the registry to help shape policies to improve organ transplantation and practices globally. There are, of course, a number of opportunities for patients. The first one that I wish to mention is the improved care and outcomes, because the data collected in the registries will enable healthcare providers to make more informed decisions about patient care and potentially leading also to better transplant outcomes. We want also to focus on enhancing the safety and the quality. For continuous monitoring of transplant practices through the registries, we can ensure that safety and quality standards are upheld, and therefore promoting patients' well-being. I have Anna Forsberg here in the room. who is a strong advocate also for patient-centered research and patient-centered care. And the prompts allow patients to directly contribute to their experience in the research and therefore shaping policies that prioritize the patient-centered care approach. And the list goes on, but these are just a few of them that we believe are essentially with regards to the integration of prompts into the ESOT registries. So where are we now? As I said just before, well, actually the registries, one of them, the ELTR, was established in 1985, and it really has laid the foundation of data-driven transplantation research and care. And it has been an instrumental tool in shaping liver transplantation practices and improving patient outcomes. So the ELTR, for which we are the custodian, is an important, I would say, example of where we should be going in the next step. In February 2021, after launch, we initiated the launch of the EPTR scientific committee, which is tasked in developing the pancreas and islet transplant registry. And right now, we are actually collecting data directly through the centers. And this expansion is aimed to enhance, obviously, pancreas transplantation and furthering the commitment of sharing knowledge. In December 2021, we appointed Dendrite Clinical System, and this partnership that I'm mentioning is a strategic one because it will ensure that we have the technology and the infrastructure to collect, manage, and analyze the extensive data in the most effective way. Later on in April 2022, the ESOT Council approved the governance of the registries project, which allows us to establish the scientific task forces, if I may call them like that, and establish the framework for an effective management of these resources. And also last year also witnessed the very first General Assembly where we had a number of representatives for competent authorities primarily to discuss how the ESOT pan-European registries should move forward. But right now, as we are, we still have a number of, I would call them the more bureaucratic exercises to finalize, but we are focused on driving innovation. So we are launching by the end of this week, actually, machine perfusion registry across organs, liver, kidney, cardiothoracic. And we have also a scientific committee, that will meet early next year to develop the data set related to infectious diseases in transplantation, also cross organs. And one of the endeavor that we would like also to start with potentially some of you in this room is also establishing the prompts within the scope of the ESOT registries. So how is this governed? We have a governance that is aimed at ensuring that there's a full transparency and full ethical principles addressed in the establishment of the registries. But so the governance is actually available on the ESOT website, but the effort, as I said, is clearly structured. It's based on the ELTR structure that has been working since 1985, and the structure of this governance allows easy implementation and the smooth development of the ESOT registries. We went through a lengthy exercise to make sure that we had secured and integrated a platform. As the data controller, we are the data controller, we've taken all the necessary measures to comply with European GDPR. We established a data processing agreement with a technical partner, providing the infrastructure of the platform, as well as data sharing agreement with all the data providers. We've established a data protection impact assessment, and we've also appointed a data protection officer. So in the scope of data protection and all policy, we are fully covered, and the risk of data breach is really kept at the lowest level. This is a very short transition to what Mirella presented just earlier, but last month the Council of Europe adopted a recommendation which holds significant implications for the advancements of the organ transplant practices across the member states. And the recommendation underscores the importance of combining data from various national organ transplant registries. And this collaborative approach allows for the sharing of knowledge and experiences regarding the different treatment options and outcomes at an international level. So this is for us a pivotal step in promoting international collaboration, data sharing, and the enhancement of organ transplantation practices, because it really is a commitment also that the Council of Europe wishes to see from its member states. One of the latest also advancements, and for this we thank Penilla for her visionary leadership and relentless commitment to advocate, to advance health and healthcare. Thanks to her, the steering group of the ESOT Patient Inclusion Initiative have issued a call to action, and this call really seeks to elevate health monitoring and quality of life after transplantation. This call unites policymakers, scientific societies, researchers, physicians, because together we really want to achieve this crucial objective to bridge the gap between science, academia, and patient, and with transparent and accessible information, we also empower patients to make informed decisions about their health, about their state. Today, for this initiative, we have actually, it's no longer up to date because we got a few more signatories since yesterday, so we're about 15 organizations who have now supported this initiative. And I would like to end this presentation by saying that the key to success of the registries is the ease of data capture, its strong GDPR compliance, its good governance, transparent governance, high quality and high value outputs, but we cannot achieve this without all the stakeholders to support this initiative, but most importantly by the transplant community, including professionals and the patients. Thank you very much.
Thank you so much, Devi, and we will come back to you with some more questions and hopefully a discussion. And I have the pleasure also to welcome Helena Almén from the National Board of Welfare. But you also have a very long title here for your position at well, actually the same authority as Mirella is coming from, and as a Swedish representative.
Yes.
So I leave it to you to really, present what your position is there, because this is too long for a business card.
Yes.
Very welcome.
Well, thank you for inviting me. I am a Swedish representative from the National Board of Health and Welfare, sorry. And I am a representative who I go to both the Council of Europe, to the EDQM, and to the EU-Commission. So you will in part see topics that you already have seen presented on other slides, but I will try to give you the aspect of how can the Council of Europe and the EU-Commission improve the follow-up of transplant results. So we talk a lot about donation and transplantation. We talk a little less about what happens afterwards, after the transplantation. And the same is for this institution, I'd say. So what is the 5-year post-transplant survival rate for all patients treated in Europe with a renal allograft? What donor and recipient's factors influence outcome after organ transplantations? And are there different strategies towards organ replacement therapies and related outcomes between different countries in Europe? And what is the role of the competent authorities? I start by a quick recap of the difference between these institutions. You've seen them before, but they were not really clear to me before I started working with these questions. So the Council of Europe and the European Union are separate organizations, and they have different yet complementary roles. So the two organizations, they work closely together in areas where they have common interests, and notably in promoting human rights and democracy across Europe. You have seen this picture before. So let's start with the Council of Europe that has a community of 700 million citizens across 46 countries. The Council of Europe could be likened to the United Nations, but for Europe. So it can easily be confused with EU institutions such as the European Council and the Council of Ministers, but this is not. This is like the UN for Europe. Its international organization is based in Strasbourg, France, and its main goals are the protection of human rights, democracy, and the rule of law. It's more about ethics, it's more about science. The Council of Europe upholds human rights and democracy through international conventions. And these are agreements which are legally binding upon member states once they have signed and ratified them. For example, the European Court of Human Rights upholds the Convention on Human Rights. Then there are partial agreements, and those allow certain Council of Europe members to work together towards goals that might not be relevant or acceptable to all states. So you choose if you want to agree to a partial agreement. And finally, every country which joins the Council of Europe agrees to be subject to monitoring mechanisms. And those assess the states that comply with human rights and democratic practices. And the picture shows some of the conventions, partial agreements, and mechanisms relating to the field of organ donation and transplantation. And as you can see, one of the partial agreements is about the European Directorate for the Quality of Medicines and Healthcare. And this is where Strasbourg, the quality and safety of substances of human origin is situated. So those are the main work areas. So it's not all about donation and transplantation, it's about so much more. And back to the CDPTO, you have heard it before, but we will talk about the transplant. In short, the focus is on ethical questions and scientific and medical questions. And the competent authority representatives are the members of the CDPTO, and this is where I represent Sweden. And the mission is, as you see, not primarily transplant outcomes. It's more about non-commercialization, to prevent trafficking, ethical safety and quality standards, policy guidelines, position papers, technical reports, to support member states in different aspects. But there is also a task that is called collect and analyze international data on donation and transplantation. There is one specific task that talks about developing links between organ exchange organization and experts throughout Europe and ensure the transfer of knowledge and expertise. And one other point is how we do this. As I say here, we have policy guidelines, we produce position papers and also technical reports. That's our mode of conduct, how we work. For example, there was the position paper on transplantation and physical activity, and the position paper on long-term outcome of living kidney donation. And for example, there was a survey this year to the member countries on how serious adverse events and reactions are being monitored for each country. And you have seen this slide before, but we will talk about how this paper talks about the follow-up for transplantation. The guide to the quality and safety for transplantation organ guide. It can be downloaded without cost. It's a very good read. It's a long read, but it's a very well, I appreciated reading it. But what can we learn about transplantation outcomes from this guide? There are 4 chapters dedicated to the follow-up. So there is one about biovigilance and surveillance, chapter 16. It has been revised to provide clear guidance for healthcare professionals and healthcare authorities setting up biovigilance systems on how to identify, report, assess, and manage severe adverse reactions and events. There are also chapters on achieving and measuring quality in organ donation and transplantation, and a chapter on measuring outcomes in transplantation. It reviews the factors to be considered when measuring outcomes in transplantation, and it is advisory to member countries. There is also a chapter on communication of risk, and it addresses consent for living donation and transplantation and provides guidance for crisis management and communication when facing serious adverse events. And finally, there is the research agenda section that has been included at the end of most chapters, identifying fundamental topics for which evidence is insufficient and non-existent, and where priority should be given in research initiatives. Next slide, about the newsletter Transplant. The newsletter Transplant is in itself an opportunity to demonstrate how the CDPTO secures fundamental rights, and it is a way to increase how we manage in increasing organ availability, how we improve effectiveness of transplantation systems, and enhance quality and safety for organs, tissues, and cells. But until now, focus has been more on donation and transplantation numbers and waiting times, and a little less on transplant follow-up. And why is that? Could it be a reason, such as access to data? Okay, over to the EU Commission. It helps shape the EU overall strategy, proposes EU laws and policies, monitors implementation, and manages the EU budget. So this is more about politics, law, and money, in short. It also plays a significant role in supporting international development and delivering aid. But how do the competent authorities play a role? There are commissioners, 27 commissioners from each member country who has different agencies for different policies, such as health and food safety. It's one of the agency. And small part of the health and food safety is organ donation and transplantation. And this is where the competent authority meetings play a role. So this is where members from each EU country come together in meetings. And we have meetings a couple of times a year. So what do we do in those meetings? We work with the framework for quality and safety and authorize and control procurement, organization, and transplantation centers. That's our task. We also issue different kinds of guidance and supervise organ exchange. The European Commission plans further action to continue supporting the organ sector mainly on 2 dimensions. It's supporting EU countries and complying with reporting obligations set in the directive, and supporting the directive via EU for Health grants and financial support to expert bodies. such as action grants on facilitating organ paired exchange. So again, where do the competent authority fit in? I tried to map it up. And the European Commission works with organ transplantation in 5 ways. So there are the directives and guidelines, action plans, EU funding of actions, and coordination and implementation. That's 5 ways to work with the field. And as you see, the national competent authorities' main task is the coordination and the implementation. The directive, the legal framework for defining standards for organ transplantation is set out in the European Organs Directive, which rules how we work. And it lays down the quality and safety standards for organs and covers all steps in transplant process from donation through procurement, testing, handling to distribution. So that's what we have to consider. But the guidelines are, as we know, it's a collaboration, and it is with the expert bodies such as Council of Europe and the European Centre for Disease Prevention and Control, the ECDC. And they develop practical guidelines that support transplant centers and procurement organizations with, for example, as the ECDC, risk assessment and preparedness plans when epidemiological outbreaks are of relevance for blood tissue, cells, and organs. And then we have the coordination and implementation. And a big part of that is exchange of best practice. And that is a lot about what we talk about in the meetings, and I'd say very important topics for us. The national authorities have some ways to work with periodic surveys to member countries. We also draft reports on the current implementation status of the legislation, and occasionally we adopt statements on topics of common interest or concern. And actions. Actions aim at supporting the EU mandate on safety and quality and can serve to promote other policy priorities such as improving the availability of substance of human origin. And now the action plan. The action plan was a non-binding instrument complementary to the treaty and to the organ-specific legislation, and defined challenges and priority actions such as evaluation of post-transplant results. It was voluntary to participate in this action plan, but the plan put forward a set of national priority actions, and you can see the actions most relevant for transplantation here, such as number 9, evaluation and post-transplant results. As a result, the action plan turned into lots of projects, and the most known are the MODE, the IFRITAS, and the EDITH, and the ongoing BRAVEST. But there were also others. The small and not so known MODE ended in specific training. Let's see, I have 4 minutes. It was about exchange of best practices from more stronger countries, let's say, to less developed countries. And then there was what was the IFRITAS project, and it tried to answer what is the 5-year post-transplant survival rate for all patients treated in Europe with a renal allograft, and other questions that I posed in the beginning. And the aim of the project was to describe the optimal content of a European transplant registry based on the existing registries in Europe and current expertise. In addition, a functional framework, a feasible technical approach, and the organizational prerequisites for realizing a pan-European registry had to be designed. But for the IFRITAS project, for post-transplant data collection, only half of the participant countries had a compulsory system in place. And important conclusions from this project was that countries may lack national registries, and missing data turned out to be a common problem. And this project ended in some recommendations, such as that stakeholder aims and support, that countries must be well informed and supportive of the registries. They must commit sufficient time to preparation of the data set and support data submission. EDIS was the next big project, an even bigger project, that tried to answer, that tried to optimize the use of scarce organ, optimize survival rates and quality of life, be able to identify risk factors, and develop preventive strategies and health policies. But one of many objectives of the project was to agree on a data set and describe a framework. But they met many challenges in this project. And one of those was there was missing data, and we don't define data the same way, such as when do you put a patient on the waiting list. So the conclusion was, and the reasoning was, that the larger the volume of the data on transplantation, the more accurate conclusions and appropriate strategies can be drawn and implemented at national level and EU level. And the project concluded that 19 out of 24 member states that have a living kidney donor registration were willing to participate in a European living donor registry, but 13 countries were both willing and able. So let's go back to the directive. One important directive with impact on follow-up for organ transplant is the Article 11, that provides that member states shall have a system in place to report, investigate, register, and transmit information related to serious adverse events and reactions. And this was what the project more or less reinforced as conclusions, but more had to be done and what to do. COVID happened, and COVID did a lot of things. It speeded things up, and the pandemic made it necessary to speed up collaboration on several topics in order to facilitate organ exchange, make donation and transplantation safe, provide guidance for monitoring, and these efforts and experiences finally contributed to the ongoing project, Bravest. And some of the actions was, and the most important was the digital solutions for EU-wide data collections, monitoring of post-transplant outcomes, and vigilance. And as you have heard, the Bravest is now active, and the project will focus on specific clinical features of donors, outcomes of allocation procedures, and operational practices to ensure the safety and continuity of organ supply, and is led by ESOT. So this you have heard twice, the draft recommendation that came this September, and it actually contains how health authorities should develop and maintain transplant registries, how procedures and infrastructure should be designed, what data the transplant registries should contain in detail, and follow-up intervals, and how data security should be protected and how publication of data should be made. And what are the competent authorities doing within the EU now? Well, they are completely or almost completely, but very much focused on the new SOHO regulations that does not cover organs. But we believe that the aims within this regulation, like extending protective measures, harmonization, improving patient access, safe and effective and accessible innovation, crisis preparedness, digital-ready policies, they will, somehow transfer open possibilities for horizontal actions that also serve the organ sector. So that at least what we believe and hope right now. Thank you.
Thank you so much, Helena. It was really informative, and I think, you know, as Mirela also showed earlier on, that I think some of us maybe have not seen the clear, you know, responsibility areas for the European Council as well as for the European Commission or the European Union in this case. And I think it's very useful also to have all these explanations and information about that, because it's, as you have shown and explained, it's so different, but even so they are connected. So Devi and Helena, may I just have a few questions? We have a few minutes left. Looking at these presentations, it looks like you're on your way to a European registry. Is it really so, Devi? Are you hopeful? Are you positive to see it in a near future, or what are the obstacles?
Well, as I said, we have the EELTR that really is pioneering and paving the way as to where we need to go. So we do have a very clear vision. Authorities, everybody sees the benefit of it. And it needs to be driven by medical professionals with the integration of, you know, of course, you know, all the stakeholders, with our industry partners to some extent, but it needs to be driven by the professionals. We know from our stakeholders that, you know, they want to see this project moving forward. For sure, we will not reach a point where 46, you know, member states will all agree on, you know, which data, standardize how and when, but we will start with those who are willing, those who are ready, those who have also the regulatory framework in place to do that. Without pointing out specific countries, we know that within Europe, not within the Council of Europe, some countries prevent data sharing outside of their country. This is, you know, national policies. So besides, you know, the commitment, we need to have the political, you know, framework to allow this to happen. And this varies, it changes all the time, and it's very challenging to follow. But we have a very strong network of transplant professionals who will advocate and help us advocate to collect the data.
Thank you so much to both of you, and the work will continue.
Yep.
And I can also say that there is excellent information at the ESOT website. And
I haven't paid her to say
no,
that.
no. But since I've been involved also in
Yep.
the position paper, I think it's really good to see what it's all about, and also to see that. We all can make a difference in this area. Thank you so
Absolutely.
much.
Thank you.
Thank you.
Thank you.
And now we're actually moving on to two other parallel seminars. It's about cancer and transplantation. In Swedish, we will have that in that room. It's about if transplanted patients can really be treated with immunotherapy. And in this meeting room, we will talk about, cancer and transplantation and the most common forms of cancer that affects transplanted patients with Henrik Benoni. So we're starting in just a few minutes.